started. I normally give 1 minute to read the question. Here is your question, please. Right, so if you have read and understood, considering it history taking station, kindly begin.
Hi, my name is Shoaib. I'm one of the surgical doctors here. Can I ask your name, please?
Hello, I'm John.
Hi, John. John, what brings you here?
Yes, doctor. I'm having this. I cannot eat. I'm having difficulty swallowing, doctor.
Oh, I'm so sorry to hear that. So when did it started?
It's around 10, 11 months.
Oh, 11 months. Yeah, it's been long. So with time, how it changed? Is it same or is it worsening?
Initially, it was difficult for me with solid foods. Now, since a few weeks, I even have difficulty taking liquid foods also, like even water.
I'm so sorry. So you are not managed to even drink water.
Yes, doctor, it's difficult.
All right. So I'm so sorry to hear that. So have you noticed anything else with this difficulty in swallowing? Is there any pain while you eat, or is there any some problem in the mouth, or is it fine from the mouth and then it's stuck down?
Yes, it's okay. There's no problem in the mouth,
right.
But there's no pain as such. But yes, I have this difficulty. Something like as if something gets stuck.
Oh, all right. So and do you feel any bad taste after having the food, or?
No, not really.
No bad taste. All right. And do you have any vomiting?
Vomiting, I had 1 or 2 episodes, but it's not really significant.
All right. And did you lose any weight?
I think so. I lost.
Have you checked, like, your clothes are bigger for you, or?
Yes, my
okay.
Yes, doctor. My husband, my wife was also saying that I looked thin compared to
I'm so sorry.
To past.
And I imagine you might be having appetite problem as well. Is it right?
Yeah. Yes, doctor. That is the main problem with me.
All right.
First thing, I cannot eat. Now I have lost the appetite also. So
I'm so sorry.
Like difficult.
I can imagine it's difficult for you. And do you have any associated problem, like any problem with the respiration, breathing? Sorry.
No, not
any past
nothing with the
history
breathing.
of pneumonia previously, or anything like that?
No, doctor. No, nothing. Okay. I can remember.
All right. And is there any bleeding or from the mouth, or is there from the coughing, or
no,
vomit? No bleeding.
I haven't noticed.
You haven't. Okay. All right. And can you tell me, is there any do you have any abdominal pain as well, or no abdominal pain? It's just in the chest.
What's abdomen, doctor?
So your
Abdominal
tummy,
pain.
your tummy
Okay,
pain.
no tummy pain.
All right.
Yeah, not. I had like one few times, but it's not very severe, or it's not really significant, doctor. It's
And
not
have
really
you?
concerning.
All right. And do you have any constipation or diarrhea?
No, doctor, no.
Okay. All right. And any abdomen and any belly distension, becoming bigger or anything like that?
No, I haven't noticed,
all right.
doctor.
And have you noticed any tiny swellings in your neck or anywhere?
I haven't seen, doctor. I think I haven't noticed. I haven't
Okay. All right.
seen.
And okay. All right. So do you feel any trouble while walking in terms of breathing? Any shortness of breath?
Not in terms of breathing, but I think like I feel weak, like compared to past time.
Okay, you feel all right.
I feel weak.
All right. So do you have any other condition, medical or surgical, any operations or anything for which you're taking medication or anything like that?
Yes, doctor. I have diabetes, and my GP has given me some medicines for that.
Okay. Can you recall the names of the medication?
No, doctor. I don't.
All right.
I don't
That's
know the names.
all right. That's all right. And I assume it's under control.
Yeah, it's under control.
Do you have any family history?
Yes. Can you present your history now, please?
So in order to complete my history, I need to take the family history and then a quick systemic review, including different systems like genitourinary and musculoskeletal and nervous system. I did CVS and others. Yeah.
Yes.
So and then I have to ask about the
idea.
Yeah.
Yes.
All right. Yeah. So 54 year. This is John, 54 years old male who has difficulty in swallowing for last 10 months, which is worsening for last 2 months. Initially it was for solids and now for liquids. He feels weak. He has reduced his appetite. He has reduced appetite, and otherwise there is no history of there is a history of weight loss, which is significant, and otherwise.
What about patient social habits? Is patient smoker, heavy drinker?
Oh, I couldn't ask.
Yes,
I couldn't ask.
Okay, so what are the differential diagnoses that you'll consider for this patient?
Well, considering the history, I would start from it could be esophageal cancer, esophageal, it could be achalasia, it could be
pharyngeal pouch,
it could be pneumonia, it could be although less likely, it could be pouch. Sorry?
Oesophagitis, pharyngeal pouch,
could be
goiter. Okay, how would you confirm your diagnosis? Time has gone, but doesn't matter.
Okay, so I will start from how I confirm my diagnosis.
Yes.
So starting from the bloods and imaging, I will go for endoscopy.
First, full clinical examination and then blood work or the lab work. Yes.
Yeah.
Then.
Yeah, for starting from the complete examination, and then I will go for some blood test.
Yes.
And imaging, but I will go for endoscopy to confirm my diagnosis.
All right. How would you confirm if a patient has achalasia or GERD? instead of carcinoma? Which test is important to rule out that?
Obviously, if it's a tumor, we
manometry.
can see on the endoscopy. But otherwise, for in between GERD and eclasia, we can go for manometry.
Yes, good. Okay, what are the treatment options that you can offer to this patient?
It depends upon the stage of the disease. If it's a tumor and it's a resectable, we will go for surgical, and I'm not sure if we give chemoradiation in this. We'll go for surgical resection.
Yes, and since it's esophagus, if it's esophageal carcinoma, then you'll do chemoradiation as well, because depends where about in esophagus you have the tumor. So that is what we do. And if it is non-operable, then what would you do, or what can you offer to the patient?
Well, if it's non-operative, then we will do some palliative procedures like stenting.
Yes. And
so
self-explanatory.
And can yes, we can go for stenting. We can go for feeding jejunostomy to resume the food.
Yes. And sometimes when it's not curable, then you offer palliative chemoradiation as well only. Okay.
Oh yeah.
Right. So first we have to give you feedback. We will be very kind and generous, but since your exam is due and we have to give you feedback which you can use as well. So Dr. Karma, would you begin first, please?
Yes, ma'am.
Thank you.
Thank you, Dr. Shoaib. He was smooth, but maybe if he had enough time, then if he had been fast, maybe he could have covered things he mentioned, things that he will cover if he had time, and he missed some points like personal history.
Yes.
And also eyes.
Yes.
And a few questions, like few specific questions that he could have asked, like about whether the food gets stuck in the throat.
Yes.
Whether he feel any lump in the throat, whether there's any gargling wet voice to rule out pharyngeal pouch.
Yes.
And also he could have asked about heartburn. He asked about pain, but not heartburn specifically.
Yes.
And and yes, he could ask other, like, to rule out other autoimmune disease, whether he have any cold hands, dry eyes, mouth.
Yes. Yes.
And
neurological as well.
Yes, neurological. Like he asked about tiredness. I mean, difficulty breathing after walking, but maybe weakness anywhere or any problem walking, neurological disorders.
Yes.
So
good.
I think these are the things, ma'am.
Yeah. Yeah, these are the ones which he missed. And if he knows the important topics, still he has time to go through and read the structured questions for each topic so that he can save his time, cover his history taking within the given time, and then he can, because he has the knowledge, all he has to know is what questions he has to prepare in order to cover the topic and go ahead with the examination, with the history taking, because then he would have a concrete evidence, concrete, basis.
I agree.
Because once you'll be asking structured questions, then examiner will also be able to understand and hear what are the differential diagnoses that you are trying to rule out. My one question is how you came about pneumonia. Is patient suffering from any respiratory?
No, I just wanted to ask if there is any associated or extension to or any I mean the size of the tumor or size of the growth, if it's affecting the lungs as well, or
that comes
associated infection.
How it happens, just imagine, close your eyes and tell me if there's a tumor in the middle third of the esophagus, and how it expands, it goes from inside towards outside. First, it will block the lumen, then it will protrude out and it will invade the surrounding structure. Right.
I agree.
So yeah.
I
So
agree.
that was totally wrong diagnosis. Like even asking that question, it can like started your timer and here is your question.